And what we do is we're primary care, but what we specialize in is inpatient hospital medicine hospitals. And we're a group of internal medicine, family practice, doctors. Also, a large component of us are what are called mid-levels nowadays, specifically nurse practitioners and physicians assistants. And what we do is we do inpatient care in the hospitals. We're the ones that take care of you when we come in the acute setting or in the ICU. But also what Boulevardy Medicine further specializes in is in the post-acute care, the post-acute setting, and what we call skilled nursing facilities. These are facilities where people go to after they're discharged for various reasons to continue therapy of many different modalities, whether it be IV or physical therapy. But we have to communicate many different things. You know, say I have Mrs. X at a skilled nursing facility or a long-term care facility. You have to be able to communicate with not only the nurses there that are there taking care of her on shift. You need to communicate with the family. You need to communicate with the surgeon. You need to communicate with the cardiologist. Not only that, then I need to communicate to my office and my office staff. There's a lot of things on their end that they have to do. They have to get it, authorized, this, that, and the other. And that's been a major, that's an issue in any practice that exists today. But I can tell you, it's been an issue with us too. It just takes, in order to address it, it just takes a lot of more manpower than I think is necessary. Because a lot of my time every day is spent on communicating, which I don't mind communicating. However, some of this is, as you can see, and as I think I'm trying to point out, is somewhat redundant. Why not at the same time that I'm informing a patient's family that I just got off the phone with an orthopedic surgeon and we're going to bring them over to the hospital and do a revision on the hip repair on a certain day. Well, why can't I send that message to all relevant people? And bam, it's all done. I don't have to go outside and sit in my truck and spend 30 minutes on the phone. It's not unusual that I'll get 70 to 90 texts a day. It's not unusual that I'll get 50 to 70 calls a day as well. But I get things via fax, which that's an issue because I'm mobile. I get it in many different ways, but then transmitting, patient info, we have to use different modalities for different hospital systems. But some hospital systems have no system in place for doctors to communicate with staff and their families and, all that kind of thing electronically. Probably, we've been thinking about that for quite some time. Did we implement a specific system until we didn't implement anything until about a year ago? What we did before is we would send stuff through the EMR, which that was just problematic in and of itself. That means you have to have your computer open and walking around with it all the time, which that's not practical. But about a year ago, we used different modalities that were like that, and they didn't work. Either they would fail, you couldn't log in, or there was just simply you can send text and that was it. There was nothing, you couldn't even send a picture, couldn't send me an x-ray. These things you couldn't take it and make it a part of the EMR, that's what we need. That's a big thing of what we need to be able to do, and that's really what we've been looking for, and there's not one that really does that. Real big thing was, number one, honestly, because it's a business, it was cost. Beat everybody else out for what you do by, a long shot. And number two, it's you provide more than just that text and maybe text picture ability. Number three, the big one, is that you can get others enrolled in this and it's no cost. And they have access and able to get into that person's chart. They don't have access to my company's personal database of patients. They just have access to that, and they can send messages back and forth just like I can. They can send them to Raina with, she does my insurance, she does my back office stuff. They can send a message to Sarah. Well, Sarah's my clinical side. I don't know, there could be another service that's offered out there like that. I don't know. But also we can start including families in this. And not only can we do that, this is my sixth point, is that we can make this a part of the chart of the EMR. And that's a big deal right there. And especially if I've discussed DNR status with them at that time, if I've just, many different things. So it's sort of all encompassing. And it's got other features that I know that we've looked at that we want to expand upon in the future. Because if we can get nurses communicating with us through here, that sometimes they get real busy. And if a nurse at, say, Downtown Baptist, I have a patient going, they're becoming tachycardic, they need to get a hold of me, but for whatever reason they can't, with this, they can directly get in touch with me or Sarah, send us the EKG, and we can give orders immediately that way. And it's just, you just can't beat that. It lets me know who I have where. Patient-wise, and now it's even good enough. It's sorted, and I know based upon just pulling up my Huku app on my phone, I can look there, and there's very basic data I need to know as the boss, as the CEO, is I know who I have where at whatever facility. It's there. That's number one. Number two. There's different patients, if they're on skilled, they have to be seen so often and things like that. I can right there tell you who's on skilled. That gives me immediate information that before it would take us maybe an hour or 2 hours of going through censuses before they could give me that answer. And that's a big deal. Because now I know where to allocate resources. I know where do I need to send my doctor? Where do I need to send my nurse practitioners? The other thing that this is doing, we always like to keep track of our patients. We want to, because it's always best to maintain continuity. Of course, we want to keep our patients because there are patients. This and Huku is doing this. Not only it gives me that census, but the other part is that we're able to follow patients better, and that's the big thing, is if you can mention that's something any doctor with a practice or any nurse practitioner, if you could say that to them, then that tells them a lot, and that's what Huku allows us to do. The other systems did not do that. Some of these COVID-19 patients, they can't, when they're in the hospital, they can't get anything. They can't have visits. They can't have their human interaction is very, very, very minimal, and that is not normal. And when I bring that up is we didn't have a good unified way of how to address that kind of thing. But I think with Huku and the others, I can much better, with what I was just previously talking about, communicating with patients. If I can communicate with Mrs. Douglas, and Mrs. Douglas might be 89 years old and can't really get around, but if I can communicate with her somehow that I'm going to go see her son, which is that's her only living relative, somehow, we can get it set up to where I can FaceTime with her at the same time. That is just freaking amazing. And that's what this is going to allow us to do. And I can keep everybody in the loop. I can have it's just a really good thing. So the COVID issue is not going away. But what this is going to do is this is going to allow us to communicate with the facilities, not only the facilities, but the hospitals, much better. We'll be able to convey to them, what's going on, what precautions we need to take, and I can also convey to like the post-acutes and skilled facilities, well, when are my people going to be there, and we can talk in real time, communicate in real time, and we'll be able to know where COVID patients may be going, and we can divert. I can better utilize my personnel that way. Know where to send them, and we can keep. Also, facilities like to be updated by the doctors. They appreciate that. I can, at the end of the day, I can, wait for the official what the updates are. Speak to my infectious diseases friends that are the real, the real authorities, the guys that really know what's going on, and then I can, convey that to my, to the facilities, and they really appreciate that when I do that. Oh yeah, I don't see how it could be negative. I mean, honestly, that'll improve patient satisfaction, patient and family satisfaction scores a lot. We usually always get scores on that anyway. Now I'm going to be like at the upper 1% now with this. But yes, and I think specifically, and more importantly, for the facilities. That's the reason I'm going to be pushing for the facilities, specifically the post-acutes, the skilled facilities, the LTACs, all those. I'm really going to be pushing for them to use HUCU, because that's going to be making management of patients, management of the practice much more efficient than what it has been. And it'll give me an overall broad overview, in my my iPad, and you can't beat that. This is something I'm going to be selling to them, because we can disseminate information quickly like that. Really, it's been easy. It's been actually a little too easy. Because as soon as we got in touch with y'all, keep in mind, used to dealing with the other places where they don't get back to you, and they're a pain in the butt, and it's not like you can pose, questions to them like I have y'all several times, and like y'all eat it up. I mean, like y'all are like, wait, please ask us questions. Others don't do that. It's been easy. It's been very easy. It's been very accommodating too. I mean, we have no issues, and y'all helped us learn how to not only start it, but y'all are showing us how to use it. And once I had these last couple of meetings with y'all, I realized how much y'all can do. We were even talking about it. There's so many things that y'all are about to do that you and I were already talking about, and these are all good things.
Right.
But it was easy. It was really. It was nothing on my part. I mean, minimal. If I just started on the service, I could do the very basics within minutes. If you know how to text message, you can figure that part out. It's been intuitive for us so far, and it's made so many other issues non-issues that we were having. That's a big deal. You got two older people going a little bit, not me, going from pen and paper, to Star Trek stuff. They're going to be looking at satisfaction scores. That's a big deal now. Hospitals used to scoff at those a long time ago, but I've always known that that's important, and that was sort of some common sense intuitive to me, because, if you're not going to have good satisfaction scores, you're not going to have patients. And I think a part of doing very, very well at it is going to be HUCU. HUCU is going to help you in many different areas. I know it already has us. We're sort of excited about some of the things it's going to be able to do. Like the one thing that I've always felt, I think any doctor feels, is sometimes I'd like to be able to talk to families a little bit more, but there's always, somewhat of a barrier. But I think this is gonna help a great deal.